It wasn't just about restaurants, it's also about improving access to healthy food in low-income communities. And we've been working with the Heart Association Cancer Society on a bill to do that, with really building on what the community health councils will be honoring Lark in a little bit, what community health councils has been doing for a long time. Because in California, every community should have access to beautiful fruits and vegetables like this. So quickly, how do we do all of this work to support healthy living? We have this 7 pieces of things that we do, and they are not necessarily in any particular order. We mobilize communities. In that grassroots campaign that we started in 1998 has now become a very sophisticated campaign in Baldwin Park supported by the California Endowment called People on the Move, where they are making policy change, community, local folks, young people working together to do things like get nutritional standards in all city facilities and city-funded projects. The whole big redevelopment is going on in downtown Baldwin Park, and it is the folks from People on the Move that are defining what kinds of stores will be there and what kinds of design it will have for people to be active. A master plan, a lot of school policies. We now have 5,000 members of our grassroots advocacy network. When there was a question of whether the governor was going to support that physical education funding, in 2 days there were 1,000 faxes sent to the governor. Research, we have done a lot of research, and our toolkit is getting bigger and bigger. It started off with simple things like this, where we looked at vending machines in Long Beach, where we showed that 97% of food in those vending machines were unhealthy. We then have done a whole variety of policy briefs looking at obesity rates by legislative district, where the numbers continue to go up and continue to go up in every legislative district in California. We looked at physical education in California and got, through a Freedom of Information Act request, the State Department of Education's own data showing that 50% of schools aren't meeting the physical education requirements. And we've now started looking at what's going on in communities. What's the food environment in communities? We looked at fast food restaurants and convenience stores compared to grocery stores and produce vendors, and came up with this new term, Retail Food Environment Index. What it says is, when you walk out your door, you are 4 times more likely to see a fast food restaurant or convenience store than a place that you're likely to get healthy food. And it's not evenly distributed around the state. There are some counties where you're only twice as likely to get bombarded with something unhealthy, and others where you're almost 6 times as likely. That's called a matter of public policy. And we did a public opinion poll. It turns out to be a great way of doing research. Folks, are you supportive of menu labeling or not? 84% of registered voters want mandatory menu labeling. We did a fast food quiz. It's in the back of your annual report. It's fun, but it also showed that only 11% of people can answer correctly nutrition questions. We always do state and local data, because local data really brings an issue home, not just to communities, but also to the media and to legislators. We do a lot of policymaker education. Rosa Soto, our regional director down here, Amanda Purcell, our policy director. We do everything we possibly can. Walk the halls, put together fact sheets for individual legislative districts, everything we can possibly do. All of our policy recommendations are reviewed, at least reviewed, if not developed by nationally recognized scientific advisory panels. Those nutrition standards that are now sweeping across the country started with a set of nutrition standards put together by a national consensus panel that we developed. Media advocacy, Mike Miller and his team at Brown Miller Communications are the best. When we release this stuff, it gets coverage. We don't have big bucks to write campaign contributions to policymakers, but we got the best communications team in the world, so we can get front page coverage. The best example, when we showed the increase in obesity rates by legislative district, front page in the San Francisco Chronicle We released the report on August 25th, 2005. The final vote on those school nutrition bills was August 31st, 2005. And all these people came up to me and they said, "You got so lucky. You released it right before the vote." Yeah, we were lucky, all right. Partnerships. This is really, all this work is about relationships. We know that it's either collaborate or die, and we partner with everybody we can possibly partner with. All of you, so grateful to be working with so many folks who are like-minded in our vision. So this coming year, we're going after menu labeling again. The governor vetoed it, but we are pulling out all the stops. Let's make sure consumers have the information so that they can make healthy choices. Let's continue to make sure, fight for access to healthy food in low-income communities. We're going to be doing a lot more of this research and more public opinion polling. We've got a study that we're doing together with UCLA and PolicyLink where we're going to show the direct correlation between what kind of food is in people's communities and their obesity rates and their diabetes rates. Look forward to that at the end of April, hopefully in a newspaper near you. We're also funded by the California Endowment to begin identifying strategies to raise a lot of money to fund what's needed in terms of nutrition and physical activity programs in California. We're going to continue our work and hopefully expand our work in Baldwin Park. We're just kicking off a 3-year partnership with the California League of Cities. The League of Cities is going to give us access to mayors and city council people in every city in California. And we're going to be providing training and technical assistance to help them establish local food and activity policies. And we're going to expand that grassroots advocacy network. I hope a year from now we're going to be able to say we've got 10,000 members of that network. We've got this vision of conditions in communities supporting people in being healthy. Every public health movement that I talked about resulted in policies being passed, folks with those same visions. The lessons are clear that public policy is critical. In 1964, the Surgeon General issued a report on smoking. Immediately thereafter, cigarette consumption began to drop. Why? Whole set of tobacco policies were put in place. Surgeon General issued a report on diet in 1988, followed up with another one in 2001, and immediately thereafter, absolutely nothing has happened. Why? We've gotten soda and junk food out of schools. That's pretty much the policy in California. None other than Newt Gingrich has said we need very big public policy changes to stop diabetes and obesity from ruining our young people. So yeah, we've made a start. One kid says to the other, dealing drugs? No, junk food. Lots of next steps. Healthy food in communities, getting rid of advertising of junk food to kids, community design, more PE, nutrition education, and again, a major funding mechanism to support all of this. We can only do this work because we've got some of the most extraordinary funders in the world who get the value of playing hardball policy advocacy, including private donors, individual donors. Someone gave me a check for $5 today. For this person, $5 is a fortune, and it's going to go to supporting this work that we do. With the work that's done is done by a relatively small staff, but an extraordinary staff. I take my hat off to them. If I had one and said I'd take my hair off to them, I guess that's what's going on. I thank you all for being a part of this movement.